Good morning, everyone. Thanks for the opportunity to present. I'm sorry I couldn't be with you there today, but I hope to hear about the interesting conversation and continue that from where we are. I'm Rumi Chunara, an assistant professor at NYU in computer science and the College of Global Public Health. Our project was thankfully funded by the Health Data Explorations Project last year. The purpose of this presentation is to give you an update of what we did during that time and how we're moving this work forward. Our project hopefully will help address part of the very dramatic increase in obesity prevalence we have had around the world in a very short period of time. This short period of time indicates that there are environmental drivers, and these have been studied at length for decades in public health. Specifically, the built environment risk factors, including walkable spaces, green spaces, have all been studied in specific contexts. What are the open questions from this very fundamental body of research? Well, it's been found that although we have an idea of what kind of features of the built environment help promote physical activity, we still need more validated, consistent, and objective measures of specific features of the built environment. We also need to be able to distinguish types of physical activity. We need to get around some of the issues that surround survey measures, which include recall bias, and also we need to examine these contributors in very local spatial environments like within the city. Now, we decided to use personally generated data, hence this project, because of its benefits, which is that we can look at very small time scales, short location scales, and we can also engage the public to gather a lot of more data that we can get through specific isolated studies. Okay. Our project, we built a platform in which to aggregate data. We started out with RunKeeper data, and we worked with our good friends at Open Humans to generate a platform which helps inform people what their data will be contributed towards. So it's done in a very open manner. And also to ideally be able to use that data, not just for our project, but then for any other related projects where it would be useful in the future. What did we find? Here are some examples of the weekly exercise trends we found from folks who do exercise using the app RunKeeper. We confirmed some kind of known trends that we have this peak on Tuesday during the week and also higher exercise levels during the weekend. We compared that to other forms of data, such as social media, where we could see similar trends during the week, which haven't really been studied in detail because of a lack of scalable and also personal data sources. We had people sign up from all over the world, so it's very interesting that we could be able to capture what's happening in different places, which will inform some of our work going forward. But of course, what was of interest was very local, very small, intracity movement as well. So here's some example data from within New York City where we could see everyone where they were moving around in relation to the built environment in the city as well. Going forward, now of course only select portions of the population use RunKeeper. We captured demographic data in our study as well, so we have an idea of that distribution. Here we're looking towards thinking through challenges of integrating other types of app data. And we're also looking at other kind of local city events. Here on the right, we've started to map out location of street fairs in New York City. So we can understand how movement might change or be according to these other types of local events. And I want to acknowledge our funding sources and our great friends and partners at Open Humans and wonderful students that we have here at NYU for this project. Now, I know there's a great conversation happening there, and Cinnamon informed us that we should spend a little bit of time talking about implications of our study for this general field. We have Keeping Pace, the study we've spoke about, as well as we run other studies that use personally generated data in epidemiological modeling. So another study anyone there can also check out is Go Viral, wherein we capture not wearable data from individuals moving around, but molecular data from when people are getting sick with specifically acute respiratory infections. So we have a knowledge base about kind of these systems in which people from the community are generating data. This has helped us think through some of the ethical implications, right, of what kinds of aspects IRBs are already looking for, what they should be looking for but maybe aren't, and kind of how we have to go about in working with them to ensure ethical implementation of our studies. Also, we have some now knowledge base of how to use observational data in population level models. For example, a piece of work we're just about to get out addresses the issue of how a lot of studies using personal generated data are now only going to be giving us the kind of numerator, where we're also interested in epidemiology in what is that population at risk, what is that denominator. So in general, working through these studies helps us inform in the future, hopefully larger studies where we can also think through how to go about gathering that data in a very systematic way where all partners are informed, and also how we can actually use this data in aggregate in different types of infectious and non-communicable disease situations and health situations. So thanks very much. My email address is here if there are any questions, and I hope you enjoy the rest of the meeting. Thank you.